So my name is Sonia. I am one of the instructors for the lactation education program through the PSU OHSU School of Public Health for our lactation program. So if you all decide to come and endeavor in taking on the world of the lactation and decide to do it through programs like ours, I would be one of your instructors for the course. We are celebrating World Breastfeeding this week, and we're looking at chatting with our very special guest speaker, Ashley, and she's going to share with us a little bit about her journey in becoming a lactation consultant and about the communities that she served within the Indigenous population and why that is such an important thing for us to know about and include in our lactation care. Let me share with you here a little bit about Ashley. My guess is she might not brag enough about herself. She has really been doing a lot in the world of lactation and advocating for the Indigenous population. I have had the honor of working with Ashley over the years in a hospital setting as well. So with all that being said, Ashley, would you take it away and maybe introduce yourself to us?
Yeah, so my name is Ashley Sayers. I'm an IBCLC. I wear a lot of different hats. I'm the founder of the California Native Breastfeeding Coalition. I work in a hospital doing inpatient lactation. Sonia was actually one of my very first, I would say almost like mentor in a way. When I was a very new little baby lactation consultant, I used to always text her and ask her questions. So previously I worked in Washington with Sonia, and now I've relocated to Southern California, came home. So I work in the hospital here. I also work in a lactation clinic. So if any of you are familiar with Lactation Hub, I also am contracted to work through them. And so I'm in their clinic quite frequently. I do a lot of outpatient consults just in community. I'm kind of all over the place. So I am also a mother of 6 mostly breastfed children. And yeah, that's about it.
Well, and one key thing, Ashley, you left out there is you were the recipient this year of the USBC award. Oh yeah, that little thing. Will you tell us a little bit about that?
Yeah, so that little thing, they definitely hooked me up. They flew me out there, gave me this really amazing award, gave me a platform to speak, which was really exciting to be able to kind of share my thought process on lactation, the way that we provide care and the way that we as lactation care providers should be providing care to community. So that was definitely a really great honor. Part of the award that I received was essentially what I did was I did a lot of community fund gathering and created a scholarship. So rather than being able to get grants to fund a scholarship, I just approached different people in the community, collected all this money, created a scholarship, and we picked 10 people from marginalized communities, and we paid for them to do their CBS, which is a certified breastfeeding specialist. And I've been providing mentorship to them and getting them trained up so that they can in turn turn around and provide that care to community.
Awesome. We do have a couple other people on the call. If you guys would like to introduce yourselves and maybe tell us a little bit why you're here today. All right. If you're not in a place where you can share, that is okay. We do have, go ahead, Michelle.
Oh, I just wanted to say hi. I'm here in Oregon, and welcome, Ashley, and thanks for joining us. And thank you, Sonia, for connecting us all together.
So Ashley, could you tell us a little bit about how you were trained and what kind of your role is in supporting breastfeeding?
Yeah, so training wise, I started with UCSD. I did their CLEC program way back when, and started out as a lactation counselor educator. And then I started working in the hospital. I was a doula prior to that. And so I did a lot of breastfeeding support. Of course, I had my own experiences with breastfeeding my children, and I really struggled. I had a really, really hard time. And I did not have access to congruent lactation care. And so there were a lot of things that I was experiencing due to, you know, my different avenues of marginalization that I just didn't feel like I could talk to the lactation consultants about. And so I kind of, that's what drew me into this field. And so I started as a doula, did a lot of breastfeeding support, and then I started working in the hospital. And I affectionately say, I think I was a little bit like forged in the fire in the hospital. The particular hospital that we were at, it was very, very busy, very high census. And you learn very, very quickly. There's a lot of really great lactation consultants there who are just so skilled and so knowledgeable. And so it really was, in the beginning, it was a lot of like frantically texting people. I would go meet patients and they would ask me questions, and I would be very forthcoming and say, you know what? I don't actually have the answer for that, but I have really, really great mentors, and I'm going to get you that answer, and I'm going to come back. And then, so I just kind of would go, I would get the answer, I would come back and, you know, explain it to them after I had learned about it, which was really great. And then I would go home and study about everything for hours. And so I feel like it took me a couple years to get really confident in what I was doing. But by the end of my time there, I wasn't asking people questions anymore, which was great. Yeah, so I don't have, you know, I guess it's a little bit more of a roundabout way of how I was trained and all of that, but it worked out.
Would your hours be considered through what we call pathway 3?
So I was actually pathway 1 because I was working in the hospital as a counselor. So,
gotcha.
Yeah.
Great.
Yeah.
What did you find as maybe your biggest challenge and your biggest joy while working within the lactation community?
So as time has gone on, I would say that my role in the lactation community, it's very much shifting. So initially I started with just patient care, and I've kind of moved into a lot of what we call lactivism, where it's a lot of educating on social issues, social justice issues as it pertains to lactation, access to care, things like that. And so as my role has shifted, my challenges have also shifted. And I think that the biggest challenge that I have kind of navigated in reality is myself. So just being forthcoming and transparent, I'm autistic. And so I definitely struggle with social atmospheres. I struggle with feeling, I guess, imposter syndrome at times. And so I just kind of was like, oh, I'm not going to do this. I have all these thoughts on things that I'd like to share and say, but I wouldn't ever do it because I just was so nervous, or I just felt like there was somebody more qualified. And I think that was kind of my biggest challenge, was kind of getting over that and realizing if people are asking to engage with me and to speak with me, it's because they value my opinion and they want to hear what I have to say, or they think that they're going to learn something from me. And so I've really just kind of like told myself, like, I'm not going to say no anymore when I'm invited to speak or I'm invited to have conversations with people. And so I think that was kind of my biggest challenge, was really getting comfortable and coming into my own and feeling like the care that I was providing was on the level of the care provided by the people I was learning from. I really cannot emphasize enough how many amazing lactation consultants I had that mentored me along the way. And so I think it took me a bit to kind of feel comfortable and feel like I was on that level with them.
So how did you make the shift and start working as an advocate and working with the Indigenous community?
So kind of talking about like cultural. So I am Indigenous, first of all. So in a way, I mean, I guess I was born into this work. My family is very well known for activism. My cousin was one of the founders of the American Indian movement, Dennis Banks. And so there's just kind of always this like family expectation that we're going to do things, right? That we're not going to sit back and just kind of let things go. So in our culture, there's kind of this belief that we all have our bundle, right? And so your bundle is essentially like your skills and the gifts that are bestowed to you. And the reason why these gifts are given to us is so that we can in turn give those to community. And so as I was shifting into, you know, coming into my own and feeling more confident, hold on a second, baby, feeling more confident in the work that I was doing, there you go. I think it just naturally kind of shifted into that role as well.
Okay, awesome.
I totally skipped over your previous question, by the way, when you were asking what is a joy of what I do. So to answer that question, I always approach my care from kind of like acknowledgement of the autonomy of each of my patients. And I really firmly believe that every person is best equipped to make the decision for how they're going to feed their baby. And there's a lot of factors that go into baby feeding. It's not just as simple as let's put the baby on there and leave the baby on there. There's a lot of cultural aspects, all kinds of stuff that really go into that. And so when I'm approaching care with a patient, I really try to do a lot of motivational interviewing and kind of really assessing with the family, like, what is it that's going to work for you? And it's really frequent that I see people, especially really immediately postpartum, where they're very raw and they're just feeling very, very vulnerable. And there's kind of this like reputation among lactation consultants where if somebody's having a hard time in the hospital, they tend to send the lactation consultants in and they say, can you just go give them a little bit of lactation love? And what they mean by that is that they want us to go in and tie everything somewhat into feeding, but also put these people back together. And so the goal is that we always leave them better than what we found them. And so I think like my biggest joy is being able to see people go from feeling some type of way, you know, nervous, just having a really hard time struggling to navigate the path that they're on, and being able to see them find that empowerment and come out of it feeling stronger and feeling like they can do this. And I feel like that experience begets other experiences in their parenting journey. And I think that when we really empower parents, of course, it's really joyful for me as a provider to be able to see that, but it's also really great to know that when we empower these parents, they in turn are going to empower their children. And those are things, you know, that are going to extend into community. In the Indigenous community, we have this belief in the 7 generations, right? So everything that we're doing affects for 7 generations. And I think that that's just a really like joyful experience to be able to know that the things that we're doing today are planting those seeds that are going to be making those changes for their future generations.
Awesome. So what are some things that you think we, all lactation providers, should know about providing culturally competent care to the Indigenous population?
So I think the first most important thing to know is we can do our best, but if you are not an Indigenous person, the care that we're going to be able to provide, it's probably not going to be, I will say it won't be congruent. And I think that the most important thing that we can do is really understand that a lot of Indigenous folks are navigating things that a lot of other folks have no idea about. For example, I'm a first generation parent. My grandparents grew up and went to residential schools that kind of fostered its own sense of trauma. And, you know, that kind of passed itself down into different generations. And so for me and my sisters, I'm the first person in my family for as long as we know of that's raising my own children. And so that experience is not something that is unique to my family. That's just a broad Indigenous experience. And so I think it's really important as we're providing this care to understand that there's a lot of nuances, there's a lot of cultural aspects that we might not understand, and we don't have to understand them, but we do need to be receptive to what people are telling us in their undertones. And so the other thing that I think is really important to understand is that when we are serving a marginalized community, our goal should always be community empowerment. So, you know, I think it's really important when we are providing this care, if we notice that we're having a lot of people from a certain population that are coming to us from care to get that care, I think it's important that we recognize and understand that we also, as being in this kind of privileged spot of being able to provide this care, that we do have a responsibility to help uplift and empower that community. And that can look like many different things. You know, sometimes that can look like mentorship or bringing somebody in and supporting them. But I think that the overall goal should always be community empowerment. And if we are serving a community, then we should always be doing anything we can to be empowered in that community so that at some point they can take over their own care.
Awesome. Thank you for that great advice. Is there anything else that you would like to share for people who are just maybe starting in this search of thinking of becoming lactation professionals and how they can serve families as we live in just this very dynamic and changing culture here?
Yeah, I would say don't limit yourself. That's something that I think I see quite frequently, that we kind of get in our little niche and we stay there. And I think that it does not only ourselves a disservice as far as what we're learning and our knowledge and our practice, but I think it also does a disservice to community. I think it's important to recognize that, you know, we all have our own gifts, we all have our own bundle, and those things are valuable. And those are things that we should be contributing to many different aspects of community. I know I mentioned that I wear a bunch of hats and I work in many different environments. But I think that that's important, not only for making us well-rounded lactation consultants, but also to be able to in turn provide that care to community. So, you know, just know there's a million different things that we can actually do as lactation consultants, not just, you know, direct patient care in the hospital. There's a lot of different avenues where we can be serving community through this work.
Awesome. I'd like to take a minute and see if there's anybody who has any questions for Ashley. While we're kind of waiting to see if anybody is brave enough to ask any questions today, I will just say also, from working with you in an environment, just starting out as that baby lactation to seeing you just evolve into just really a person who is bringing so much to this profession to empower people in their choices and how they can care for their babies. You have been doing a wonderful job, and we need lots of people like you that understand wearing lots of hats is the way to go in this profession, because serving our communities and empowering people to do the right thing for themselves is always what will make people feel like they belong and have a place in this profession here, and while being cared for. Michelle?
Absolutely. Yeah.
I just had a thought. So Ashley, you mentioned about working with Lactation Hub, and I think so is that virtual consults?
So I do telehealth. I also do in-person appointments as well. So telehealth, everything goes through insurance. And so, yeah, long story short, yes, both clinic and telehealth.
Well, since for some of us, telehealth is relatively new, can you share anything like if there's any benefit, or what have you noticed about telehealth versus in-person?
Yeah, so telehealth, I think when we hear telehealth for a lactation consultant, or consulting, we're like, how are you going to do that if you can't touch somebody? And I think that kind of ties into when we really tap into that autonomy, right? So when we're in person, there's kind of this it's easier to touch sometimes. It feels like it's like, let me just do it for you. Of course, we don't say that, but it's a lot easier if we're going to be just touching and showing them how to do something, versus in telehealth, you really have to tap into their autonomy and use a lot of description and things like that to explain to them, this is where you want to place your hands. This is how you want to hold your baby. These are the reasons why. And so I think that one of the benefits of telehealth is that we can't just show them what happens when we place our hands in a certain position on the baby. We really have to give them this in-depth education on the reasons why. So they're leaving the consult, one, feeling a lot more empowered, but they're also getting a much deeper understanding of these are the reasons why we're suggesting to do these things. And then, of course, another really great benefit of telehealth is accessibility. I have lots of patients who really struggle just to get into clinic. And if it's something that's pain or weight related, we really try to get folks into clinic. And it's very, very difficult for some people, and it's inaccessible. The other thing is that telehealth, in certain ways, it's more cost effective as a provider. Because most of us already have essentially this package deal where we're paying for our medical record, EMR records, things like that, our charting systems. So we already kind of have this monthly membership. And so the cost for us is also much lower, which means that it's a lot easier to turn around and essentially gift that to someone in community, where if we know that this parent is really struggling and maybe I don't have the bandwidth to actually take a lot of time out of my schedule. Even one consult in clinic, that's a 3-hour process at minimum between, the commutes, the actual consult, all of that, versus in clinic or in telehealth, I could do a telehealth in 45 minutes and then they're still leaving better than when I found them. And so I think that accessibility piece is a really big benefit of telehealth as well.
That's good to hear.
Yeah. We do have a question in the chat. It's from Elizabeth that says, do you go to a specific place to provide counseling within the community?
So it depends on which avenue folks are finding me through. So when we're talking counseling, I always kind of like jokingly say that when we're providing lactation care, it's only about like 10% technique and the rest of it is like counseling. We're, talking folks down. And so it really just depends on what avenue they are finding me in. So if it's something like, so I do a monthly breastfeeding class and a monthly support group through the California Breastfeeding Coalition for Natives. And so that's online. I also do a support group in the hospital that is also kind of that counseling type of deal. And then clinic, inpatient. So it really just kind of depends on where they are finding me or I'm finding them, where we're getting connected.
Awesome. All right. Well, I told you I would not keep you on here for too long, and it doesn't look like we have any more questions coming in. So I just want to thank you again for taking the time to come and answer some of these questions. And Michelle, I know that you had some info for other folks in on the call, but I just wanted to give one last final thank you so much to Ashley.
Yes. And Ashley, thinking of that, would you, like, let's say I have a family here in Oregon, but wouldn't it be nice for a culturally specific lactation referral that I might be able to say, oh, I know somebody who could, and do you find that that's going on?
That happens quite frequently, to be honest. Lots of folks will they know somebody or they come into contact with a potential client and then, they kind of recognize like, hey, there's probably some nuances here that might not be my niche, or I might not actually pick up on these things. Let me send them to somebody who does meet their kind of cultural background. And I think we all do that as providers too. But I definitely get quite a few referrals that way. Yeah. So if you have folks who you feel like could benefit from having, you know, Indigenous specific lactation support, definitely send them my way.
Great.
Yeah.
And
I see
and then,
everyone, not just Indigenous.
Of course.
Yeah.
And then is there's like, do you have a list of, you know, just so we could share with future folks that to spread, you know, I don't know, maybe if somebody's in Florida, I don't know if you could share that with us, like a networking group.
So usually what I will say to people, right now, I'm pretty happy with Lactation Hub, to be honest. I just really love them. I love their work and everything about what's going on. I just love the work that they're doing. They're very, very involved in kind of behind the scenes, also activism and social justice and supporting community and things like that. So I have just been telling people, you can just book with me through the website. Or you can always just reach out. My phone number is like all over the internet. Send me a text and I will let people know, okay, this is how I'm currently booking. I'm trying to move everything over to going through Lactation Hub so that one, I don't have to have a new like EMR system, but also just to get it through insurance and all of that as well.
Great.
Yeah.
Okay. Well, thanks. We will be looking at that.
Thank you.
I'm just going to share my screen to show folks what Pathway 2 programs do, and just in case anyone is interested. So let's go to this slide. So a Pathway 2 program helps you get placed in the community or the clinic. So everyone still has to do the prereqs, and then they do 100 hours with Sonia and her co-teacher, Lisa. And then they interview for the practicum group, go through some pre-work, and then practice 300 hours over the course of the 9 months. Then they take a test. We all know about the IBCLC exam, and then get the results 3 months later. So that's just one way to become a lactation consultant. And here is where you could email us for more questions and to hear more about it. Well, thank you everyone for your time today. We really appreciate it. And I like your vow, Ashley, to say yes. Because that included us to hear your story today.
Yes. Yeah. If you guys would have asked me a year ago, I would have been like, I don't know. Let me send you some other names. So yeah, it's working out pretty good though. I feel like it's getting easier.
Oh, good. Awesome.
Yeah. Yeah. All right. Well, thank you. I'm going to hop off. I got a patient coming in soon, but thank you.
Bye. Thank you.
Bye-bye. Take care.
You too. Thank you.
Okay, well, with that, Sonia, do you have any other final words or?
No, I just encourage anybody who has any questions about the lactation fields or the program to definitely reach out, and we can give you lots of different insights and avenues and answers. There's lots of different ways you can get involved, just like Ashley said. So if you want to explore more about that, just don't hesitate to reach out.
All right. Happy National Breastfeeding Month, everyone. We'll see you next week.